Urinary tract infection explained. Bacteria are the chief cause of UTIs, although in some cases, fungi, and in rare cases, viruses can cause urinary tract infections. UTIs can occur in any part of the urinary system, i.e. the kidneys, bladder, urethra, ureters. They are among the most common infections in humans. I mean, we all have either had a UTI or know someone that's had one. Most infections involve the lower urinary tract, specifically the bladder and urethra. Urinary tract infections usually occur when bacteria enter the urinary tract through the urethra and multiply in the bladder. Causes of UTIs. Women are at a higher risk of having a UTI than men due to female anatomy. More specifically, having a short urethra. Having a short urethra decreases the distance that bacteria have to travel to reach the bladder. The urethra's proximity to the anus is another common reason for increased UTIs in women. Bacteria from the anus can get into the urethra and travel up to the bladder and kidney. Ever heard of the suggestion to wipe front to back? Now all of a sudden it makes a little more sense. Types of urinary tract infections. The type of UTI is based on where the infection is in the urinary system. They include cystitis. It's an infection of the bladder and can be caused by many types of bacteria. But E. coli, Escherichia coli, is the most common one. Cystitis. It's an infection of the bladder and can be caused by many types of bacteria. But E. coli, Escherichia coli, is the most common one. E. coli is normally found in our GI or gastrointestinal tract. Urethritis. It's an infection of the urethra. Urethritis can also be caused by E. coli and other types of bacteria. This is likely due to its close proximity to the anus. The urethra, being near the vagina, can also be infected with various STIs, or sexually transmitted infections. Gonorrhea, chlamydia, herpes are just a few that come to mind. Pyelonephritis. It's an infection of the kidney. It can be caused by E. coli bacteria, as well as other types of bacteria. Symptoms of UTIs. Depending on where the infection is in the urinary system, symptoms may vary. If the infection is in your bladder, more commonly known as cystitis, you might experience the following symptoms. Feeling like you have to go all the time, yet only going a small amount. Burning sensation during urination. Occasionally blood in the urine or cloudy urine. Pelvic pain. Dark color urine. Urine with a strong smell. If the infection ascends to the kidneys, also known as pyelonephritis, you might experience the following: fever, chills, nausea, vomiting, pain in your side or back. Risk factors for urinary tract infections in premenopausal women include a history of urinary tract infections, frequent or recent sexual activity, especially with multiple partners, diaphragm use, spermicide use, obesity, kidney stones, sickle cell trait. In postmenopausal women, things like vaginal atrophy, poor hygiene, prolapse, diabetes, incomplete voiding, or incompletely emptying your bladder, are risk factors. So how do we diagnose and treat urinary tract infections? Most clinicians will treat based on symptoms alone. Otherwise, a simple urine analysis will do. While a urine culture is certainly not necessary, I typically obtain one to ensure that the causative bacteria are sensitive to whatever antibiotic therapy I have prescribed. Typical antibiotic regimens for treating urinary tract infections are usually 7 to 10 days in length. To eliminate issues with compliance, I tend to prescribe a 3-day course of one of the approved regimens. 3-day treatment regimens are as effective as 7 to 10-day courses, with cure rates noted to be greater than 90%. These steps can be taken to decrease your risk of developing a urinary tract infection. Drink lots of water. Increasing your water intake will help dilute your urine and cause you to urinate more frequently. This will allow bacteria to be flushed from your urinary tract before an infection can begin. Urinate after sex. Drink cranberry juice. Studies are not conclusive on whether cranberry juice works. However, it's likely not harmful. Remember, watch the wiping technique. You know the one. Wipe from front to back. This helps prevent bacteria from the anus area from spreading to the urethra and vagina. Keep your genital area clean. Remember, less is more. You'll want to avoid using potentially irritating feminine products or deodorant sprays, douches, powders, etc. that may prove to be irritants to the vagina and or urethra. For more information on UTIs, please read my blog post on UTIs at AskDrAngela.com. Thank you.